Today our topic of discussion is epistaxis. It is very important. You should be knowing that what is epistaxis. It is bleeding from inside the nose is known as epistaxis. And more importantly, epistaxis is not a disease. It is a sign, right? You should be knowing to understand epistaxis, the blood supply of the nose. Broadly speaking, the nose is supplied by the external carotid and the internal carotid system. In the internal carotid, anterior ethmoidal and posterior ethmoidal artery is responsible for the supply. And in external carotid system, there are different arteries. You can read it. The most common sites of the epistaxis are two, right? This is a very important question, that what are the two common sites of epistaxis? You have to write Little's area and Woodruff's plexus. Little's area is located in the antero-inferior part of the nasal septum, just above the vestibule, and it is a point of union of four arteries. Which four arteries? The anterior ethmoidal. You have to remember these four arteries: the anterior ethmoidal, the septal branch of the superior labial, and the septal branch of the sphenopalatine artery and the greater palatine artery. They all anastomose here, and they form the Little's area or the Kieselbach's plexus, right? Now you have to remember that if there is bleeding in this particular area, it will lead to anterior epistaxis, right? And the second common site is Woodruff's plexus. It is a plexus of vein that is situated inferior to the posterior end of inferior turbinate. This location is important. This was on the antero-inferior aspect of the nasal septum, and this is inferior to the posterior end of the inferior turbinate. The causes of epistaxis are local, general, and idiopathic. In local, you just have to remember the mnemonic of TANDIF. T for trauma, A for atmospheric pressure changes, N for neoplasms, D for deviated nasal septum, I for infection, F for foreign bodies. So these are the local causes. The general and also in the local causes, these were nose related. And in the nasopharynx related, you have to remember the mnemonic of JAM, J-A-M, juvenile angiofibroma, A for adenoiditis, and M for malignant tumors. The general causes you have to remember, just go system wise: the cardiovascular causes, the blood disorders, the liver disorders, the kidney disorders, the drugs, the mediastinal compression, and acute general infection, and vicarious menstruation. This is an important term that you should be remembering, that epistaxis at the time of menstruation is known as vicarious menstruation. So these were the general causes. In this, you have to remember the system wise, and in case of the local causes, you have to remember the mnemonic of TANDIF for nose and JAM for nasopharynx, and idiopathic is the cause is unknown. Moving on to the sites of epistaxis. The two common sites were Little's area and Woodruff's plexus, but it can also occur above the level of middle turbinate, below the level of middle turbinate, right? Posterior part of the nasal cavity, diffusely, or from the nasopharynx. Now, how do you classify epistaxis? The two major classifications are anterior epistaxis and posterior epistaxis, right? In this particular area, this is most common in the young children, and this is common in the adults, and especially those who are having hypertension. So what happens is that in posterior epistaxis, the blood flows back into the throat, and the person is having vomiting, bloody vomiting. And if you're not taking a proper history, then you will be making a blunder of diagnosing it as hematemesis. So proper history will lead to the diagnosis of posterior epistaxis. So you should be remembering this point. Anterior epistaxis occurs when the person is sitting. So this is a very important difference that you can remember, that this is more common, this is less common. And anterior epistaxis from the Little's area, posterior epistaxis mostly from the posterior area and the Woodruff's area. Age is in children, age is after 40 years. It is mostly trauma, and nose picking is the most common cause of anterior epistaxis, right, in children. And in posterior epistaxis, the cause is hypertension or arteriosclerosis. In anterior epistaxis, the bleeding is mild and can be easily controlled by local pressure or anterior pack. But here, it is severe and hospitalization and postnasal pack is required, right? Management. For example, a patient is coming with epistaxis. If it is mild, then you can go with this case. But if it is profuse, you immediately have to give first aid. What is the first aid? You have to just pinch the nose between the thumb and the index finger for 5 minutes, right? You have to give cold compressions, right? And then you can be doing under anesthesia cauterization when the bleeding point is located. Anterior nasal packing is done, and if anterior nasal packing is remaining for more than 2 to 3 days, you also have to give systemic antibiotics to prevent infection and the toxic shock syndrome. Anterior nasal packing, posterior nasal packing, endoscopic cauterization, and the SMR operation, and the ligation of vessels. Ligation of vessel, we will be discussing it further. We can also do the transnasal endoscopic sphenopalatine artery ligation and embolization. These are the points that you have to cram, right? But if you will be having a concept, you should be remembering that first aid, right? Pinch it or give cold compressions, right? cauterization, anterior nasal packing, posterior nasal packing, and endoscopic cauterization, and TESPAL, which is TESPAL, and transnasal endoscopic sphenopalatine artery ligation, embolization, and the ligation of vessels. For example, if the conservative measures have failed, we can do external carotid ligation. If there is uncontrollable posterior epistaxis, then maxillary artery ligation can be done. If it is not controlled by packing, then ethmoidal artery ligation can be done. So what are the general measures that you should say whenever a person is bleeding via the nose? What should he or she be doing? Make the patient sit up with a backrest. Mild sedation should be given, the hemodynamic factors should be recorded, and he should be maintained. Check the pulse, BP, and respiration. Antibiotics may be given if there is sinusitis, and oxygen may be required if complications arise. Now, one term that is unique, this is hereditary hemorrhagic telangiectasia, right? This is occurring on the anterior part of nasal septum, and it is a cause of recurrent bleeding. Right, this is a bit different from epistaxis. This is a different point, which is hereditary hemorrhagic telangiectasia. This diagram will be clarifying you that from where the person is having lesions or bleeding from the nasal septum and tongue and the fingertips. As you can see in this particular diagram, this is visualizing it very beautifully. Moving on to the treatment, it can be treated by using the argon, KTP, or ND and YAG laser. Right, septodermoplasty is done, and then this is the treatment, and this is the whole of the video for epistaxis. You just have to remember the management, the types, the common sites, and the etiology, which is very important, the cause actually of epistaxis. Hope you understand.